Dr. Duffy. Choking is caused by chorea. So would chorea medication help with choking?
Swallowing is very complex motor movement, and it's affected by many different symptoms that people experience with Huntington's disease. So, choking, we think about in relationship to swallowing. Swallowing is a complex motor movement. So, when we think about planned motor control and movement, we think about telling our body part or parts what we want it to do. I want to walk over and pick up a glass, right? I want to put that glass up to my mouth and then I want to swallow. And we don't really think about kind of our neck and sort of the structures around our esophagus is very complex, but there's so many muscles that live in this area that have to coordinate to try to put our lips around the glass, to get the water into our mouth, to hold the water into our mouth, into a bolus, and then get it down into our throat, and then get it into the right spot, which is down in our esophagus, into our tummy, and not into our lungs. And so it's a multi-stepped process that requires a lot of coordination. And so what we see with people with Huntington's disease is you lose coordination, right? You lose fine motor abilities, balance and coordination. So getting on your pants, zipper, socks, swallowing, it's all part of that coordination. So that in itself is a coordination piece of it. And that's really difficult to treat with medications. And a lot of that comes through the therapies that we have people engage in. So, physical therapy, occupational therapy for those larger and smaller fine motor tasks, and then speech therapy for, speech is a complex motor task in creating the language and amplifying the words, right? And then swallowing. So, what's going out and what's coming in. And so, requiring speech therapy to help us with those mechanics of swallowing. So that's so important. And just because we've done it once doesn't mean we don't fall into old habits or forget the things that we were taught, and we have to kind of brush those off and do them again. So speech therapy is a really integral part of our therapies in general. So I'd say that's kind of core for swallowing, making sure that we're using good habits for swallowing. So for liquids, you know, when we open up our mouth like that, it's just like floodgates. Everything can come down and we can't coordinate it. So making sure we're in proper position and we've got good angles and we're using a straw to make sure that we're using proper mechanics. And then people with Huntington's disease tend to like to eat fast a lot and stack their food. And stacking means take a bunch of bites. Even if you've cut it up really small and you've got it all organized on their plate, they're taking 5 of those at the same time and it ends up becoming one big bite. So I call it small, slow, and steady. And making sure that you're taking one bite at a time, it's small bites, and that you can coordinate all the structures around it to get where we want it to. I just talked to someone yesterday about putting a sign right in front of their plate that says small, steady, slow, so that their loved one doesn't have to keep reminding them. Which you do. You have permission to do so to make sure it's a safe environment. And then superimposed on top of that is making sure that they're eating the proper foods that are moist and able to eat, no trigger foods like dry, difficult. And then if you have chorea, which can happen in your what we call oral lingual area, so in your mouth, or diaphragm, or upper body, that complicates things. And so treatment of the chorea can help take that component off of it. And then if there's tics, so people can have tics in their head and neck and mouth, and then breathing in and out, which can complicate swallowing. And so if you manage the tick and take that out of the equation, you manage the chorea, take it out of the equation, and then address the behavioral mechanistic parts of it, then you can approach it. So it's multifactorial.
Yeah. Thank you, Dr. Duffy. Dr. Napolis, there is nothing out there to help with HD, nothing anyone can do, so why would I see a specialist?
Thankfully, the answer to this is false. There's plenty that you can do, and then there's plenty that we can do. And let me talk about that on so many levels. So Dr. Duffy already mentioned this. I'll emphasize this. And I think because it's not sexy, but lifestyle can be a major factor in onset and progression of Huntington's disease. She mentioned, I agree. It's not just for that. It's whatever ails you, whatever illness you may have, but in particular for degenerative diseases like Huntington's disease. So the things that are healthy for your body are healthy for your brain. So first of all, the things that you can do are to live a healthy lifestyle. I'll say it loudly and clearly. There's no amount of alcohol that is healthy. Alcohol gets totally normalized in our society. It's a toxic drug. There's no amount of alcohol that is healthy. And for anybody who has a vulnerable brain, it's going to light a fire on it. So alcohol ingestion is not good. So exercise and diet, really, really important. The other things are that there is great symptomatic treatment. And so in the context of, is there nothing to do? There's absolutely things to do. And because I'll bring this in, and Dr. Duffy mentioned it, it's not only just extending your life, it's the quality of your life. So being able to improve the symptoms of Huntington's disease, even if you aren't necessarily changing the trajectory, can have a major impact on the quality of life. And whether that happens in treating behavioral symptomatology or emotional symptomatology, whether that means managing chorea. And by the way, our medications for managing chorea are pretty awesome these days. VMAT2 inhibitors are really awesome. And then I'll also just mention all the emotional part, meaning that we already mentioned how important it is for community. And I would hope that you would consider your treatment team part of your community. And I'll just make a shout out to centers of excellences, but also to seeing a specialist. But if you go to a clinic, and in particular if it's a center of excellence, you get a lot of touches. I mean, in our center, you get our most amazing clinic coordinator, Dr. Amy Lemke, right? Starts with her, but you see a psychiatrist, you see a neurologist, you can see a neuropsychologist, you can see a speech therapist. All of these people are dedicated to helping you and managing your disease. And all of those things play a factor in the quality of your life in dealing with your disease. So there's plenty that you can do, plenty that we can do. So please come see us.
Thank you.
And I will just add, sometimes we underestimate the power of talking to someone that just understands and gets it and won't look at you like you're, what we hear, crazy, or just tell you, well, okay, you're depressed. Well, just pull yourself up by the bootstraps and think of positive thoughts, type thing. Like those of us that are at a center of excellence, we understand HD. We understand how challenging and how complex it is. And while we can't make HD go away and we can't, make the symptoms 100% go away, like we can't cure it, we can support you through this journey. And sometimes in our society, we undervalue the importance of people that understand what you're going through and just know, and being able to communicate something with just a look on your face, or and just being able to go. We're also a safe place. Believe me, we've laughed with people, we've cried with people, we've done both at the same time. These are all important factors in your journey because we're all human and we need people that understand us. And Huntington specialists, one, are all very dedicated to Huntington's, and two, they really, really get it.